and gentlemen, we've had two fantastic panel discussions this morning, and now we continue with a very special presentation. The gentleman who will be gracing the stage, well, he's one of my star panelists over the last 2 days, so I already know that you've got a very exciting session ahead for you. I'm just going to invite our wonderful members of the booth to please come and take a seat, take a load off, enjoy yourself, be part of the next session. There will be a chance for a Q&A with our star speaker. So may I please encourage people to come and sit down and have your questions ready. Now, we're going to be looking at transforming Veneous. How do I say that word? I need my speaker on stage with me. Transforming venous health through innovative solutions. Dr. Khalil Afsh, who's the Medical Director, HealthPoint Hospital, Head of Cardiovascular Department. Please give him a big round of applause.
Thank you so much.
Dr. Afsh, now I stumbled on that word. What does it mean? Transforming
Venous health. Veins, varicose veins. Diseases are coming from vein disease.
Ah, fantastic. I'm a space enthusiast, you see, so my brain went straight out to the galaxy. Now, this is a very exciting presentation.
It is.
Thank you so much for preparing it. The stage is yours.
Thank you so much. Thank you. Good morning, everybody, and thank you so much for coming to see us here at M42. Today, I'm very proud to present to you what I call as disruptive technology in vein health. Let me start. I'm not going to be clinical. I'm going to be mostly presenting you the technology that will be, inshallah, deploying here at M42, especially at HealthPoint. The clicker is not working. All right. I mean, this is just the only anatomy I'm going to show. If you look at I'm going to talk basically about the vein disease of the legs, right? We know there are deep and superficial vein systems, okay? Those systems are present in our body to bring blood from the lower part of the body all the way up, right? Back to the heart. Now, in order for us to defy gravity when we stand up, there are valves, and those valves are actually there to prevent blood from going down. Venous disease, in a nutshell, is because those valves are not working. And that is because of something like genetics and so on and so forth. We're not going to go into that. Once this happens, there will be venous congestion, particularly in this part, okay? And that actually creates varicose veins and all the likes. Now, this is not only what I'm talking about. I'm talking about the sign. Can we go back just one slide? Yeah. This is not only cosmetic, guys. People think that varicose veins are only cosmetic. The stages are long, okay? We can start from just looking at spider veins, varicose veins, all the way to venous ulcers. And that disease is very, very relevant. Just back one slide, please. So in order for us to do that, what we do is we get rid of that superficial vein, either from the front or the back, and other veins, of course. How did we do that? Now, in the past 10 years or so, in the 1990s, 2000, we were using surgical techniques, basically cutting and stripping the vein out, right? So that was cumbersome for the patient, comorbidities, so on and so forth. Now, going forward, between 2000 and 2010, we created more technology. We call it minimally invasive. So basically, we were getting a small incision here, going with a catheter, and doing either or, either thermal ablation, where we go actually and destroy the vein by using electricity, or we inject a glue called cyanoacrylate that closes the vein. So that's the theory. Fast forward, 2010, 2020, and this is what I'm here today to show you. We are bringing in disruptive technology to take care or ablate the superficial veins from outside the skin. How cool is that? So instead of me coming in and telling the patients, you know what? You're going to be admitted to the hospital. I'm going to give you anesthesia. So for the patients, no incisions, no scars, and immediate going back to work. For the physicians, it's amazing. You know, anesthesiologists, we don't have to get them to the hospital, no sterile room, nothing. It's completely from outside. How does that work? So the machine is like an ultrasound machine, and you can see it right over here, right? It's made up of a generator that actually connects to a robotic arm that has a cooling system, and you operate through this touch screen, right? Just learn that thing from me. This is called a VTU, a visualization and treatment unit. Why? That is the tip of the robot in touch with the vein on the skin. That gives you ultrasound guidance, so you see what you're targeting. That is surrounded by a focalized ultrasound transducer that fires up, and all the energy is concentrated to a focal point. It's very small, around 1 to 2 to 3 millimeters at max. We call it in our industry as a grain of rice. Now, I'll show you how that works. So once we do this, imagine this is my probe, which is this, coming on the patient's thigh, and I'm firing off HIFU, high-intensity focalized ultrasound. Once I do that through that spherical unit, a deposition of very high energy goes into a very small focal point, and that, boom, burns it up. It heats it up to almost 90 degrees centigrade, causing immediate coagulation necrosis. And it's the size of a grain of rice. You know, the veins that we do, just to give you an idea, when they're dilated, they could be anywhere between 4 to 5 millimeters in diameter, up to almost 8 or 9. So you can imagine that every time I shoot, I go down and I have to move and shoot more. So it's like a video game where you're actually targeting from outside, shooting the energy inside. So this is the robotic head. As you can see, there's a balloon here. You say, why there's a balloon here? We have a patented cooling solution that actually circulates from here to the machine, and that's always in touch with the skin. Why? We don't want to burn the skin, because when we give that amount of energy, we want to be just focalized. We don't want to burn the skin. This is the base of technology. When I look at it, okay, I'm shining from, oops, back one more time, please. Sorry, the clicker doesn't go back. Just turn the video on. So imagine yourself, this is the cone shape coming down like this, okay? And that all concentrates in this grain of rice, having an area of around probably between 6 to 18 millimeters squared, but a temperature that goes up, we underestimated here, just for the graph, it goes up at the center to almost around 90 degrees centigrade. Very hot. Patient would feel it. Okay, now, I think you understood the concept. So here I am, that's my cooling balloon. I'm shooting the energy, and that's a grain of rice. Beyond that, AI algorithms within the computer would not allow any more heat to go into the surrounding structures. And even if you hit an artery, believe it or not, you're not going to have any issues. The artery is pretty thick. So there will be a pause after every pulse we give in order not to burn the skin. And every time we shoot pulse it, the machine will actually give us the pulse duration, the pause time, all AI operated. This is how we get the patients in. This is a patient that I'm trying to ablate their superficial greater saphenous vein. And this is the robotic arm. As you can see, no sterility and nothing. And what you see here is we use a special kind of gel. We put it into an immobilization sac, so the robotic arm does not move. We have our target very fixed. And then this is our touch screen, where we have our target point here. That balloon is inflated, so we push it down, emptying the vein from blood, because when you want to heat, you don't want to have blood inside. And when you heat, the vein is like this, and the energy is coming all the way to the posterior wall. And you can see 1, 2, 3, and you should see the pulse coming now. Turn the video on, please. Pulse is coming, and you see the pulse. Do you see that? Can you do it one more time, please? So this is my target, the balloon on the skin. Pulse is coming. Did you see kind of a small explosion? We call it HEM, hyperechoic mark. And that demonstrates coagulation necrosis. On this side, this is actually the sequence that I'm doing with the patient. On this side, I can move the robot right, left, up, and down. And here, actually, I press for the pulse, and this is how much joules I want to give the patient. It is not labor easy. At this level, it is still labor intensive, because we do few millimeter slides at a time, and we're supposed to ablate the vein. But nowadays, we ablate 10, 15 centimeters of the vein. That is enough almost to stop the reflux from the lower aspect of the leg, and patients actually feel much better almost instantaneously. This is a histological section of a vein treated by Sonovein, where you can see the green part, actually coagulation necrosis, is completely closed. And that is exactly the same what we see using radiofrequency or laser ablation. So the results are actually exactly the same with similar closure times. The patient journey is easy. We lay patient on the table, as I told you, in our offices, no operating rooms. We hook the cooling device with our easy pack solution. Then we position the patient. This time is a small saphenous vein. And we use our touch screen to deliver the pulses, and the patient is home. There's no need for compression. There's no need for anything. I just want to show you a small video to illustrate exactly what I'm talking about. Please turn it on. This is the robotic arm with the cooling fluid. That's the ultrasound, and that's the focalized transducer. You can see it delivering the energy. This is the patient with a vein. And there you go. Deliver high-intensity, free focalized ultrasound, and the vein immediately shrinks. This is the only technology of its kind in the world. It has been developed over the past 10 years, being used on thyroid nodules and breast cancers. But we found out that, you know what? It works on veins. And in 2019, the CE mark was given. We just got a clearance for FDA. Studies going on, so it will be approved hopefully very soon. So we are taking KOLs around the world still. We have treated almost 2,000 patients. The closure rates is around 95% with complete reflux abolition. And we have been presenting it all around the world. So to me, this is a disruptive technology. The first time ever we can ablate superficial veins from the skin. I'll take any questions you have. I know I don't want to exceed 20 minutes. So please, any questions I'm available to ask about technology, about technology or the treatments. Anybody here? Please, can we get a mic for?
Sorry. There we go.
Thank you. Hi. Thank you so much for an amazing presentation. I just wanted to find out how painful is the procedure?
Amazing question. Actually, I'm going to answer double answer. Number one, this is heat, and we give heat to the patient. So heat comes through the skin. The cooling part, the balloon, alleviates a lot. But nowadays, when the patients are more sensitive, we're able to give them local anesthesia, okay, around the vein, just maybe not more than 3 to 4 cc's, and they're done. So yes, there is a little bit of pain from that we can alleviate with local anesthesia. We are working on also having a better, probably, pathway for patients in HealthPoint when things are ready to hopefully go without local anesthesia. Please.
Thank you, Dr. Afsh, for the great presentation. I would like to ask about any complications, like any skin damage after the procedure. That's question number one. And if you would consider that procedure for anybody with advanced venous stasis, or should we direct the patient as early as possible?
Amazing question. Number one, we don't honestly have any skin reactions. Patients leave with the skin extremely cold because that cooling balloon is around 14 degrees centigrade at all times. So the answer to your question is no. Note here that we cannot do any veins that are closer to the skin, less than 0.5 centimeter. So our inclusion criteria is 0.5 centimeters and more. And you know, we've never had any skin issues with that. The other thing is that when they have venous stasis, this is certainly advanced venous insufficiency, and you should really, at that time, consider them for two things. Look for deep venous insufficiency, obviously, and make sure that you ablate their superficial veins as soon as possible. This works for that as well.
Great talk, Dr. Khalil again. My question is, this will be applicable to pelvic congestion syndrome?
No. The answer is no. This is only applicable to superficial venous insufficiency. Pelvic congestion syndrome, you're talking about veins inside the pelvis, and the treatment is completely different. It's actually pretty invasive. Yeah. Any questions about the technology, the applications? Thank you so much. As I told you before, I think this is disruptive technology, and I do believe this is the only part in my career personally that I get to use it and apply it here in the UAE. Thank you so much.